Hello students, you're welcome on Learning with L&R, and today I would like to talk about the topic that is concept of health. And under this topic I would like to discuss with you about the indicators of health. What are that? These are the guidelines which indicate the health status of a country, and we uses the indicators for to measure the health status of a country. We can judge the condition of the health status of one country. We can compare the health status of one country with another country to assess the healthcare needs, to plan and implement healthcare services, to evaluate the healthcare services. What are the indicators we can see? They are mortality indicators. Mortality means the death rate. Morbidity means the disease rate. Disability means disability of the people. Nutritional status, the people are malnourished or they have good well balanced diet. Then healthcare delivery indicators. After that, the indicator of social and mental health utilization rates, health policy indicators of quality of life, environmental indicators, and other indicators. Mortality indicators under this: crude death rate, infant mortality rate, maternal mortality rate, child mortality rate. We can discuss in detail. Crude death rate, what are that? Number of deaths per 1000 population per year in a given area. That is called crude death rate. Then infant mortality rate. Infant means the child when the age group is from birth to 1 year. That is called infant. Number of deaths of infant per 1000 live births during given year or population or country. It's most important indicator of health because it reflects not only the quality of maternal and child services but also the availability and utilization of the services. Then maternal mortality rate, it's about deaths during antenatal, intranatal and postnatal period. Antenatal means when women pregnant. Intranatal means at the time of during delivery, and postnatal after the delivery. Child mortality rate, number of deaths of children between 1 to 4 years during a given year per 1000 mid-year population of that age group. This excludes infant mortality rate. Now I would like to discuss with you about morbidity indicators. These reveals the burden of the disease in the community. Thus, these are used to supplement the mortality rates. The following morbidity rates are used for assessing the health status. First one, incidence rate, notification rate, outpatient attendance rate, hospital admission and discharge rate, duration of stay in the hospital. What does mean of incidence rate? It's number of new cases of particular disease occurring per 1000 population per year. Then prevalence rate, total number of both old and new cases existing in the population during a given period or time. It's percentage of population suffering from disease, that is called prevalence rate. And disability rates, percentage of the population unable to perform the routine expected daily activities due to injury or illness, that is called disability rate. Then nutritional status indicators, incidence of low birth weight, weight and height standards of children up to 5 years. Then healthcare delivery indicators, these indicate the availability of health manpower resources of the country and thus provision of the healthcare. Utilization rate, it's the proportion of the people actually utilizing the healthcare services in a given population during a given year. Percentage of infants fully immunized. Indicators of social and mental health, these includes the rates of crimes, assault, murder, theft, suicides, homicides, accidents. These indicators provide a guide to implement social attention or social action for improving the social and mental health of the people. Thank you so much. Thank you for your attention. I hope you have clear with this.